Hello and welcome to this webinar all about the hip. Now the hip is a joint that I term the bully. It's a powerful joint that's crossed by lots of powerful muscles, and as a result it can really be problematic, not just for pain around the hip but also further down towards the knee and the ankle. So what we're going to do during this webinar is we're going to talk about some of the conditions related to the hip. Well, in this webinar, as I said, we are going to talk about what the hip joint is first and foremost. It's good to understand what the joint does, the injuries that we see around the hip, the glutes, Piriformis Syndrome, hip flexor issues, Trochanteric Bursitis, snapping hip syndrome, LABRAL tears. So as you can see that there's multiple conditions, and arthritis being another one that can affect the hip. So what I wanted to do in this short webinar is just give you some of the understanding of some of these conditions that clinically we see pop up in the clinic related to the hip. So what is the hip? Well, the hip is a ball and socket joint. Now what that means is we have a ball at the top of our leg bone and a socket in the hip pelvis area that creates this ball and socket joint. Now, ball and socket joints are great because they allow the most amount of movement. So we have lots of movement at the hip joint. But in order to create this movement, lots of muscles cross the hip joint. So what that can mean is that it's a slightly more complicated joint and there's more areas that can cause potential dysfunction. So injuries of the hip as a result require very thorough investigation because there's many things that can be contributing to it because of the multiple muscles that cross it. It's the top of our chain in terms of our lower limb chain. So the hip joint sits at the top of our leg and therefore it has this crucial role in providing stability throughout that leg. So as a result, again, it can lend itself to developing dysfunction. So what we need to do, as we do with correcting any injury, is what I term fix the leak properly. Now, and this is where I see injury treatment go wrong, is that people just try to treat the effect, the painful area, and they're not looking for the cause. So I liken this to a leak in a roof at home. If we had a leak in the roof, what we could do is we could put something, so if I had a leak here, I could plug something into there. And with that might stop the leak for a bit. But we know once the rain comes back and the water comes through, it's going to come through because we're not correcting the cause. So what we need to do is plug the leak, we need to stop the pain, but we need to investigate wherever the cause is coming from. And that's what we need to do with injury. And as I say, in particular, something like the hip where we've got lots of muscles that could be contributing to problem, we need to give a thorough investigation. So the muscles that cross the hip, as I mentioned, there's many of them. We've got the quadriceps or the thigh muscles. We've got the hamstring muscles. We've got the glutes. The big, most powerful muscles in our body, those glutes that cross that hip joint. The hip flexors, often a forgotten muscle that sit on the front of the hip joint. We've got our groins or adductors, the TFL muscle that sits on the side of the hip, sartorius, our longest muscle in our body, crossing the hip and running right the way down to the knee, and also our gracilis, a much less known muscle but sits between the hamstrings and the groin. So the glutes is one that I want to start talking about because a lot of dysfunction that we see at the hip, the glutes has a big part to play in it. And we can see in this picture here, we have these big glute max muscles, glute med muscles, but deeper to that, we have lots of other muscles going on as part of this glute complex. So these are things that we need to investigate. They are our most powerful set of muscles. And the gluteus medius in particular, so when we see injuries related to running, they have a vital role to play in terms of stabilising our hip joint, this gluteus medius. So we see a lot of dysfunction in those, particularly in people who are running a lot. If we have a lack of flexibility or a lack of strength in our glutes, this causes a big problem down throughout the lower limb. So again, when we're looking at hip pain or treating hip pain, but it may well be lower back pain or even knee pain, we really want to be investigating these glutes for their flexibility and their strength. So they attach onto the outer hip bone, what we might term the hip bone. So we've got what we call a greater trochanter on the outside here, and you can see these glute muscles come in and attach onto the outside. So a lot of time if we're getting that pain on the outside of the hip, it might be these muscles that we want to be investigating. Okay, Piriformis syndrome. Now, Piriformis syndrome is something we see very commonly, and what we need to understand firstly is what the piriformis muscle is, and it's this deep glute muscle running through here. But why it's significant, we have something called the sciatic nerve. The sciatic nerve, which originates in our lower spine, and it comes out and it runs down and supplies our whole leg. So the sciatic nerve runs down like this. But what it does is it passes either through or very close to this piriformis muscle. So if we have dysfunction and tightness or trigger points in this piriformis, it can be a huge cause of sciatica. So sciatica is an irritation of that sciatic nerve. So this is a really important muscle for us to understand. Again, I mentioned it about gluteus medius, but this is very common in runners. It is a big cause of sciatic pain for the reasons I've said, that the sciatic nerve runs very close to or actually straight through that piriformis muscle. So if it tightens, it can clamp on that sciatic nerve. And if the muscle becomes tight, it clamps, as I said. Pain can be felt running right the way down the leg. So again, if we've got sciatic pain, if you've got pain in the hip and it's running down the legs, it can very much be a cause, a problem of this piriformis muscle. And people often describe this as like a shooting, burning, tingling, pins and needles type sensation running down their leg, which lends us to thinking that it is a sciatic type problem. The hip flexors, the muscles that sit on the front of the hip. Now again, very much forgotten, but problematic in a lot of people. For example, hip flexion lifts our hip, it lifts our leg, but when we're sitting, we sit in hip flexion. So these muscles have a real tendency to become tight or overactive. And as you can see, they actually come up and attach onto our back as well. So again, a big cause of lower back pain, but they cross the front of the hip. And where we typically get pain is right on the front, on that sort of hip bony area that you can feel. We can get this tear in this deep stomach muscle here that's crossing over. So it's actually two muscles that you can see that converge to make this one tendon that crosses the front of the hip. And so hip flexors are often forgotten, but something we really want to be addressing. So deep stomach muscle that crosses and lifts the hip. And it comes about often, I find, as a secondary issue. When I'm working with people with hip flexor pain, so if you've got pain pinching on the front of the hip, it may well be a hip flexor issue, but that's come about as a bigger hip dysfunction, as I say. And this is where we're looking to fix that leak, to really truly understand where the problem is. So for an example, the hip flexors, I will often investigate the glutes and things and find that there's been a glute problem there. But the glutes, being our biggest, most powerful muscles, are better at coping with early dysfunction. But once it gets to the hip flexor, which is a much smaller, much more sensitive muscle, we really start to notice that pain. So if you're feeling pain on the front, and particularly if you lift your hip and you feel some pinching, that might really imply a hip flexor issue. And it can result, if you are a runner and you're experiencing this pain in the front and you have to drag your leg, you're unable to lift, you're unable to contract that hip flexor, that's where it might be a hip flexor issue. Trochanteric bursitis. Now, let's explain a little bit about that because it sounds a complicated term, but if you've got some localized pain on the outside of your hip where you can feel that bony lump there, which is what we call your greater trochanter, now that is likely to be a inflamed bursa. Now, again, this is very much what I consider to be a secondary injury because what the bursa is, well, what we have bursa all over our body. And what they are is little fat pads that separate the muscle tendon from the bone. And they prevent where we've got areas of tendon or muscle going over bone from rubbing on each other. But what that tells us is if the bursa's become inflamed and you've got this localized pain, that muscle group is acting on that tight. It's too tight or there's a problem in that area. So as you can see, you've got this greater trochanter out here and we've got these muscles running out to it and we'll have the bursa in here as well. So if these muscles become tight, they can cause a problem for the bursa. So yes, we need to treat the bursitis, but we need to be understanding the cause. And in the case of trochanteric bursitis, my go-to point usually would be the glutes. For that reason. So yes, we want to manage things like inflammation with ice or rest, but we need to be treating the cause. Back to that fixing the leak analogy. We need to be understanding what our condition is and what's causing it. Snapping hip syndrome, again, very similar. I've mentioned that we've got these muscles running out to that hip bone, that greater trochanter. Now, it's sort of is, as the name suggests, without being as dramatic as the name suggests. So what's happening here when we get a snap and hit syndrome? Now, we'll know about snap and hit syndrome because you may hear an audible click or noise at the hip joint. And what that is a tight muscle structure passing over those bony prominences. A lot of the time it's painless. It's often a condition that we just sort of are aware of but don't experience pain. But what we want to be doing is we want to be addressing those glute muscles. We want to be understanding where the tightness in the hip that's causing that hip to snap is. So again, that could be through the glutes. It could be through TFL, which is the muscle that sits on the side of the hip. It could be a hip flexor issue. But we really want to understand what it's showing us is it's an early indicator that there's some dysfunction going on. So, as I said, typically caused by the snapping over the bony prominences. If it is a painful condition, if you really suffer with that snap and hit syndrome, that's when you certainly want deeper investigation. But it is often, as I state there, painless, but is a really good indicator that we've got some hip dysfunction. So what I would say, if you're feeling clicky hips, but you don't, you're not suffering pain, I would still get those investigated because you can catch things before they start. It's almost a warning, if you like. Tightness in the glutes is a common cause. Labral tears. Now, to understand what the labrum is, now this is where we move slightly away from the muscle structures and we think about the joint itself. And I mentioned that we have a ball into a socket. Now, the lining of the socket of the pelvis there is what we call your acetabulum, and it's surrounded, or it has some cartilage, as does all surfaces, to make those rub on each other smoothly. And in the case of here, this one here is what we call the labrum. So we have this lining of the joint called your labrum, but we can get tears in there. So then when the bone starts rubbing, or the joint starts rubbing, you can really feel some soreness deep in that hip. As I said, it's the lining of the joint that keeps it running smoothly. It is possible to treat this labrum, but it's very difficult to diagnose without MRI. So if we were to suspect that, or if conditions weren't settling with our expected treatment, that was when we would recommend an MRI. So in more severe cases, it can be treated surgically, but we can also manage these labral tears. The important thing is to understand what's going on globally around that hip so that we're not causing tightness on the joint, which would aggravate that labral tear, if that makes sense. Now, arthritis, one of the things I get asked about a lot. It's a degenerative condition. Arthritis is one of those things we cannot cure. This is the one condition that I've mentioned that we will not be able to cure, because once it's there, arthritis is a damaging or almost a flaking of the bone surfaces. So it's a degenerative thing, and we are all degenerating. So when it comes to arthritis, I tend to say to people, it isn't something we're going to cure, but it's certainly something we can manage. So it's our wear and tear. We all suffer certain stages of arthritis because it's damage to the articulating surfaces, the surfaces that join each other. But it cannot be reversed, but it can be managed. But what is absolutely fundamentally vital in the case of arthritis is that we're not putting excessive force on the joint. If we know that we have a problem where the bones meet each other on the joint, it's not surprising that the tighter we make those muscles, the more clamping on the joint, the more we aggravate that. Whereas if we can actually loosen those muscle structures and allow that joint to move happier, we are going to be happier and you're not going to feel the effects of arthritis. And again, we have this phrase, motion is lotion. What we want to do is we want to lubricate the joint that's suffering with arthritis, in this case the hip. So again, having movement that we can do is key. We don't want to stop, because then we stop sending a blood supply to the area and you'll really feel that arthritis. So when it comes to arthritis, it's about understanding the movement that you have at the hip, the strength that you have at the hip, but really understanding exercises that you can be doing that will help the condition. As I say, we're not reversing it, but what we're doing is we're managing it. We're allowing it to be not so prominent. So I don't like it when I see people and they say, well, I've got arthritis, so I need to stop, I need to give up, because in fact, that's the opposite to what I think we should be doing. Okay, yes, it can result in hip replacements, but these don't need to be the fear that perhaps once people had about having a joint replacement, because we work with lots of people post hip replacements and the results are fantastic. Okay, so that's the worst case scenario. But what I want to be saying as well is, even at the worst case scenario, it's not a bad thing. I want us to have a more positive view towards arthritis. So how do we remove hip pain? Well, there are multiple pathologies at the hip, and therefore injury guidance really should be made via a detailed assessment. So what I would be suggesting for you guys is if you feel that you are suffering with any of these pains or symptoms, reach out to us and we will be happily arrange an assessment for you. We have our clinics, which are based in Orpington and Bromley, where we will welcome you for a face-to-face assessment. But we also have our virtual clinic. If you're not able to make it into us, we can see you virtually, where we can go through and get an understanding and look to build a personalised rehabilitation program for you. The process is relatively simple in the sense that we want to, number one, be understanding what condition you may be suffering with. And hopefully this webinar has given you some information about some of the more common ones we see. But then we want to be addressing that hip. We want to be understanding, right, is there any flexibility issues of any of those multiple muscles that cross the hip and affect it? Is there a lack of strength at the joint that we need to be addressing? And then what we want to be doing is applying manual treatment, so soft tissue massage, self-myofascial release with rolling techniques, in order to be removing any adhesions in tissue to make the joint a happier joint, and then provide you with a personalised rehabilitation program where we will be talking through with pictures and videos the process that we think that you should be following in order to restore yourself and return back to doing the sports and exercise and achieve the goals that you want to be achieving without pain. I hope that information on the hip was helpful, but if you do have any further questions, reach out to us and we will be happy to help.